of our award winners presenting on work that's going on in their patches, and at the end there'll be some more interactive Mentimeter fun, which I hope you'll all stay and participate in, because that will certainly help AphA going forward. So without further ado, I'm going to introduce you to Martin Pitt. Martin is the president of AphA, but also director of the Pencord research team down here in Devon, and he's going to talk to us about AphA through the looking glass, so quite intriguing. So Martin, I'll hand over to you.
Thanks, Alison. I didn't know you were a West Bromwich supporter.
Not me, not me.
It's not you.
Nothing to do with me. Apologies, it's not my office.
Before I start, welcome everybody. Before I start, I just want to say that I live out in the sticks in Dartmoor in Devon, and we've had a couple of momentary power glitches this morning, so I'm just hoping we don't get any more, but if I do disappear, I'll aim to get back as quickly as I can, but hopefully that won't happen. But if it does, you'll understand why. So I'm going to share my screen now. Hopefully that'll work. So can somebody just say, because I can't see you now, can somebody say if you're just seeing one slide?
Yeah, we are.
It's AphA through the looking glass. Great, that's all working then. So last session, I thought probably the last thing you want is a long diatribe with lots of bulleted point PowerPoint slides. So I've tried to give this a little bit of a lighter feel and look at AphA as I see it, at least, and it is a very personal perspective. From my engagement with it as president in the last almost 2 years, but also before that, my involvement. So hopefully this will be a little bit more entertaining than just bulleted listed points. So with apologies for Lewis Carroll, we'll continue. So the first thing I want to say, if I can get these slides to move, let's try again. First thing I want to say is we need to celebrate and trumpet our success as an organization. It's really easy when you're on the inside of an organization to underestimate how much you've achieved from the inside. Things always look better when you're looking in from the outside rather than when you're on the inside, where you tend to see all the things that might be going wrong and all the glitches and everything. So let's celebrate what we've got. And there's a tremendous amount to celebrate in this organization. What a dynamic organization it is. I mean, we only started in 2012, a mere 8 years ago, which is a brief flicker in time in the grand history of the development of the health services. And my understanding is it was sort of the brainchild of both Paul Strainer and Alison Wilkinson, because they sort of set it up in the Southwest after chatting over a beer, I think it was, in a pub table. And the first conference was, I think it was in 2013. I remember going to the second one, which was in Bristol. I didn't meet the first one. But it's worth noting that I gave a presentation at a regional event at the same location in Taunton as when they'd had the first conference. And our regional event had more people in it, the Southwest region, organised by Heather Edmonds, amongst others, had more people than the initial conference in 2013. And that was in 2018. So that gives an indication of how quickly and well the organisation AphA's grown. So in 2014, there was a committee established, and then in 2016, a board established. And then in 2018, a mere 2 years or so ago, we incorporated as a community interest company with a fairly minimalist constitution that is currently in the process of being amended. And then we're looking now at a brand new board structure and constitution, which augurs for a very exciting new step forward, I think, under the guidance of Rony, but also the whole board, the people who've come forward as board members. I think it's an incredibly exciting new horizon that we're looking at. And I'll say a little bit more about that towards the end of this, this presentation. So yes, we have a right to feel smug. And I think it's important we say that because, haven't we done well? But on the other hand, and let's look at some of the things that have happened in AphA over the few years that it's been in existence. We've got a growing and increasing and hopefully an increasingly enthusiastic and engaged membership. The professional registration piece has really developed. I think we need to pay a special homage to Glenn Howard on that front, but now it's being picked up by Gary and Emma, is it, who've picked up the professional registration piece, and that's such an important piece in terms of developing the status of analysts in the health service. The regional organisation, we've gone from a sort of southwest-based thing to something that's spread over the whole of the UK, and not just England. We've got Scottish, Northern Irish and Welsh contingents, and that's a really essential part of the way AphA is going. A lot of its strength, in my view, will come from its regional organisations as we move forward. We've got increasing outreach. I think there's more that can be done. There's increasing recognition. We're beginning to engage very closely with other organisations. And again, special tribute, I think, to Matthew O'Reilly for all the really hard work he puts into the AphA magazine. That's a real resource. A very impressive piece of work, Matthew. So I'd like to pay tribute to you there. And I think also we're building collaborations. We're beginning to raise our profile. We're beginning to be known in other places. And a particular thing that I'm interested in is developing our links with the universities and trying to harness the obvious benefits that can come from linking with higher education institutions and sort of funneling the research. And that's been a kind of cause celeb, my little hobby horse, if you like, for the last 20 years of my life. So it's something I'm very keen and very willing to participate in. And I love being part of AphA for that particular reason. So we've got an evolving infrastructure and constitution. I think Rony might want to say a little bit about that in time to come. And we've got ever expanding conferences and events. So I was particularly struck, we had the event in Cardiff that many of you will have been part of, and also the one in Manchester last year. And unfortunately, we couldn't have the one in Birmingham this year, but I think it's, you know, we've gone from sort of one-day events to residential events and all that comes with that, the social stuff that comes with that. And, you know, I think that was a real coming of age, particularly the Cardiff conference, I think sort of moved us on a significant step in terms of our organisational strength. So loads to celebrate, but no room for complacency. So much more to do. I think we need to be ambitious as an organisation. There's so much potential that AphA could realise if we can get our act together. And I think there's a number of steps we can take, and there's a number of areas where we need to improve, I think, as well. And that was recognised in a recent sort of board development day we had some time ago in Taunton. And we highlighted a few of these things, and I think a number of those are being picked up at the moment. And I think with the new board structure, the new constitution, this will give us a brand new platform to develop some of these things very clearly. So I think firstly, we need to get onto a stable financial footing, and we need to, such that we can build resources, we can involve more people, we can potentially have a sustainable team of people running AphA, you know, not just living from hand to mouth to some extent and worrying about our finances. So I think that's something we can work towards. We need to build our profile, attain greater recognition, and increase our linkage to a range of different organisations. I put universities because that's my particular bag, but I think there's other places we need to go. The arm's length bodies and so on, the other professional associations, etc., etc. I think there's a lot we can do, and I'll say a little bit more about that in terms of the training, capacity building programs that we can provide, as well as the sort of associated administrative functions that go with developing capacity building programs, such as quality assurance, for example. We can build our networks. You know, I was struck by somebody saying in an earlier session that there aren't really any established mechanisms by which analysts in trusts, for example, can share best practice between them, can ask each other questions, can create that sense of community and mutual support. So I think that's something that AphA could potentially provide. And obviously there's the professional status, which I think is absolutely critical, key in bringing about the greater recognition and status of analysts across the health services. So I think we need to be developed to a position where we're having influence. I mean, examples are, you know, scientific and technical. Why aren't we classified Why aren't NHS analysts classified under scientific and technical rather than admin and clerical? You know, why haven't we been able to make that change happen? We should be able, in a position, it'd be nice to think we were in strong enough position to lobby for that and get that change made. Another example was Chief Analytic Officer represented at trust boards. Another example that we talked about this morning would be the lobbying for greater data sharing and access, for example. The other area I think that AphA's got a fair way to go is developing really strong mechanisms for engaging with the wider membership. And I'm sure that the constitutional changes and other things that are going on with the organisations and structure of AphA will be important in promoting that. So the other thing I want to say is this is our time. There's so much happening now that supports the development of a professional body such as AphA. And I'll list a few of the things here. I think the COVID crisis, we heard earlier today about, you know, how much opportunities are being presented to us within this crisis. And Paul Strone at the very beginning of the conference mentioned this idea of harnessing the energy of a crisis. I think there is something in that. I think that there's a lot of recognition now for the importance of modelling, the importance of data, the importance of forecasting, and so on and so forth, all the sorts of stuff that health service analysts do. There's also ongoing, coupled with that, there's the ongoing developments within the data science community and health services. A lot of recent stuff that's coming out, and which is increasing recognition of the importance of the tools that we use. There's the use of AI, the technological advances, all sorts of things going on with the use of the internet and so on that sort of support the cause, if you like. And within that, there's a greater recognition of the use and the importance of data. And that's being recognised, you know, not just kind of in things you can't measure easily, but in the establishment of a host of new initiatives. So, for example, the recent creation of the Health Data Research UK, NHSX, another recent incarnation, if you like, and these are just examples. NHSR community, the increasing prominence of analytics within the Health Foundation and its recognition there, for example. So there's a whole range of different things happening that are kind of making the tide run with us. You know, so we need to capitalize, we need to harness that energy, and we need to use that to move AphA forward, in my view. And as we heard earlier from a number of people, we need to work together and we need to organize collectively. I think that came through very clearly in some of the earlier talks. So that's where AphA can play an important role. And we need to be less like this. We need to develop a more assertive outlook, I suspect. Too often in the past, analysts have been sort of like dormice, when we need to be like the Queen of Hearts. We need to be assertive. We need to be making the running in a number of areas, and I think that's something that we need to look at and to develop over time. We ran a course in Exeter that some of you are probably familiar with, called the Health Service Modelling Associate Programme, where we as a research team teach and mentor people from the health services, mainly sort of analysts from trusts, for example, or CCGs and so on. And it's quite striking how there's a certain lack of confidence, for example, in coming forward and presenting. But we were really struck that when we had a presentational session with those analysts, just how, you know, if you give them the confidence and give them a little bit of rehearsal, just how good they were at presenting their work. So I think it's just a hidden talent that hasn't really been realised, and we need to bring that out in the analytical community so we can have a stronger voice and be a little bit more assertive. So moving on, what are we looking at as we move into the future? Well, one of the things that's happened, as many of you will know, is that AphA has instituted a new organisational regime. I can't resist doing this sort of thing with my presentations. People accuse me of having too much time on my hands with Photoshop. There it is. So we're entering a new era, I think, and Rony, bless him, has come forward as the new Chief Operating Officer, the leader, if you like, of AphA. But I think that, you know, we ought to recognise there's a whole new team and a new board that will be available to support AphA as it moves into this new phase of its development. So we're looking at a new dawn. Well, this is my own personal reflections, but I hope some of these ideas are shared by other members of the AphA membership more generally, but especially by the board, the regional leads, and so on. So what should we be looking for as we move forward with the Association of Professional Healthcare Analysts? Well, my view is we should be looking to create it as a de facto national representative body for health service analysts across the UK. And who knows, we might even get a royal, so we might become AphA in time to come. It's amazing what happens when you put the royal in front of your name. It does give you a certain amount of clout for some reason that I don't quite understand. And some of the things that we might associate with a new national body such as this. By the way, I'm getting no feedback. Are people hearing me okay? Can somebody say yes?
Yes, Martin, we can.
Yeah.
Yes.
I just suddenly had the thought I'd be sort of speaking to a black hole and it wasn't all working. So, so yeah, why don't we think big? Why the nurses have got the Royal College of Nursing, the doctors have got the BMA, British Medical Association. Why shouldn't we think in terms of establishing, the de facto representative body for health service analysts? Surely AphA's in a position to grasp that nettle at this point. We've established the base. We've done so much good stuff. We're in a position now to move forward with confidence. So some of the elements that we might associate with that development would be these sort of things. Financial sustainability. So we're getting income from a whole range of different sources. Some central funding, maybe, some membership subs, some sponsorships. And having a diverse set of income sources will provide us with both sustainability, but also independence, because we won't be beholden on any particular sponsor for our existence. So I think that's important, the idea that we're an independent organisation with a diversity of funding sources. As soon as we rely solely, for example, on a government funding, we suddenly become beholden to that funding source, and who pays the piper plays the tune, and I think that's a danger that we need to be aware of. But if we have a diversity of income sources, that's overcome. And who knows, if we had enough money, we could have a team of people working full time, to support and promote AphA's objectives. We're talking, for example, lots of thumbs up from Paul. We talk about the comms, somebody to manage comms and publicity, promotion, membership. We could imagine, and why not, a small team working, with Val, who's done so much good work to date, to build up. What about an HQ, an office where we can hold events in time to come? When we get out of the COVID crisis, we can hold events there. We can have meetings there, and so on. There's all sorts of things we might think of. To quote John Lennon, I may be a dreamer, but I'm not the only one. I think, we can think in these terms. Network and collaboration. So we can do a lot to strengthen our links with arm's length bodies, Health Education England, NHSE, IX, and so on, to raise our profile. We also need to build our links and make ourselves prominent within the educational community, the universities. There's so much that can be gained by harnessing that collaborative partnership link with the universities. So much good work doing there. And the universities themselves are looking for ways in which they can apply some of the research and skills that they have, the expertise. So there's so much to be gained from building and fostering those links. As well as that, we need to think about how we can establish networks so that we can share as a community more widely. We can share best practice. We can sort of share our problems so that we can solve across the UK. And you know, as I said before, I was quite struck that there doesn't seem to be an infrastructure, a mechanism whereby health service analysts can do that currently. So why can't AphA see itself taking on that role? And I think there's a lot to recommend the regional structure of AphA. I think that's one of its key strengths, in that there's no substitute really for being close together and being able to meet physically again. Once COVID is blown over, hopefully we can start looking at sort of really building out of that regional strength. So learning and capacity building. I mean, obviously, this one of the primary things here is the professionalisation. You know, the registration work that's being done. I think that's absolutely key, a foundation stone for a lot of this, because it gives the recognition. But AphA can do a lot in that space too. We can look at the development and maintenance, not just the development, the maintenance of a recognised national competencies framework, for example. So AphA becomes the standard by which analysts are assessed. We can build partnerships with the key organisations, as I said before, to embed our role in that space. You know, NHSX, Health Education England, so on and so forth, FedIP. I think that's beginning to happen, and you know, a lot of credit to Paul for that work. In placing us in that quite squarely in the middle of that, in the middle of those developments. We can also partnership with some of the provider organisations for training and capacity building, notably the universities, the apprenticeship schemes. Health Data Research UK are doing a lot to build skills and capacity within the UK NHSR community. A whole host of different organisations that we can link to build those, but it would be great to see ourselves as sort of central in that particular range of activities, because I think we've got an awful lot to offer. The other thing that we might want to do is see ourselves as a quality assurance body, so that we can kite mark, for example, certain training courses and so on that we recommend, and maybe not those that we don't, because there's a lot of rogues out there as well as good training organisations. And we can, coupled with that, we can do signposting to the various courses that might be appropriate. So next, lobbying and influence. We might even get to the stage where Rony's being called into the health select committees and the Houses of Parliament to answer questions about health service analysts. So maybe even you, Paul, don't laugh. But I mean, that would be a mark of success, wouldn't it? If we had that level of recognition.
Yeah, absolutely.
Well, why haven't we had any clout to date? Why haven't we got things like information sharing, classification of analysts into science and tech? Why haven't we got chief analytical officers? Well, in most cases we haven't. There are some good examples of where they are there, but you know, so you know, getting that influence, and also getting the influence to you know, raise the status and dare I say the pay of analysts within the health service, because I think that's absolutely critical. Giving them a clear promotional line of sight, to use Paul's famous phrase, so that you know there isn't just, you know, you can only go so far as I understand it in the analytical community before there's no obvious route forward, and analysts so often end up, you know, in other streams like finance, for example. So providing a supportive and collective identity for analysts in the service, I think, is going to be important and not to be underestimated. So, you know, somewhere which gives us, you know, well, not me particularly, I'm an imposter really, but the NHS analysts as, you know, that sense of a shared identity and a means of, you know, collective support. Somewhere to go, you know, for help sometimes, or, you know, a listening ear. And finally, and certainly not leastly, I think there's a real role for AphA. You know, I think it's really important we keep that element of fun, creativity. It's often a characteristic of young organisations, that there's a sense of dynamism, of enjoyment, you know, and creativity, freshness, if you like, that comes with being new. And as things become more and more established and settled in their ways, they can sometimes, the danger is that those things get lost in the process, if you like. So I think it's going to be really important as AphA moves forward that we don't lose sight of that aspect of what we do. Certainly on a personal level, I'd be very sad to see some of those elements go, and it's one of the reasons I've enjoyed so much being part of this great enterprise and growing enterprise, and to see the changes is so important. To see things going places, and to see the enthusiasm and the engagement and dedication of some of the people involved, or most of the people involved in AphA. So I think my main message is I think there's so much to celebrate here. So I've sort of rattled through the slides. That's my last slide. I think in a way I'm not sad about that. I think better for all of us to have a chat and to have an interactive conversation about this at this stage, rather than me rattle on anymore. But I'd just like to say thanks to everybody that I've had connection with through AphA as president. I'll be president for another 3 months or so, but it's been a real honour to have that role, and I'll be continuing in my role as a sort of engagement with higher education and university research, so that building that link and acting as that representative on the board. So I'll leave it there and stop sharing the screen, and then open it to everybody else to share their thoughts. And I know others, especially those that have been most actively involved with AphA, will want to share some of those things, and maybe come back in terms of some of those points I've made. Thanks. So, Rony, I don't know whether we need to sort of open the floor and invite further comments from anyone.
Yeah, thanks, Martin. It's really, really useful presentation. Everything you said, I agree with. There's a very emerging landscape, and we do need to do a lot of works going on, as you probably heard from lots of the speakers yesterday. Nationally, there's a lot of work going on, and how do we enable ourselves to have that lobbying voice amongst all those works? So it's a really good thing, and we will be working together as a board and with all of you. How do we make that happen? So I don't know, Paul, if you want to say anything.
Thank you, Martin, first off, for your perspective on AphA. And as you say, it is easy to lose sight of how far we've come in quite a short time, and not to underestimate the size of the challenge which still remains. I think a lot of your challenges are very appropriate, and I think and you kind of laid down the challenge for the incoming president to drive some of that forward. So thanks very much for
setting you up.
Yeah, I think some of these things, there is work in progress around the whole chief analytical officer agenda and the recategorization into admin and clerical, from admin and clerical into technical and scientific. As with all of these things, they always seem to take inordinately much longer than you would expect in terms of doing something. So something which I thought was as simple as changing a set of coding in an ESR database to reflect that change, obviously is much more involved with all of that. I think one of the things that we do need to do better at is reach out more to our social care chums in terms of analytics. And also whether or not we need to do, and just looking at the chat, I think we need to do something similar with public health as well, in terms of bringing them much more into the fold. I think my initial thoughts on that were, I thought they were quite well served in terms of a lot of the things we were trying to achieve. But actually, having conversations with them, it would appear that that's not quite as done a deal as I thought it was at the beginning. So I still think there's lots of work to do in that area as well. I think the other challenge I would say that we have is around challenging this concept around the digital academy, which I still think is a very laudable aim, which is being done, but its focus is to IT for me. It's not inclusive enough. And when we talk about informatics, people talk about that in a kind of collective way, but I think they're really talking about IT rather than the kind of analytical end of the thing. So I think we've got some work to do to engage with those folk as well. So still lots of work to do, but as we may hear from Rony, I think we've got a plan for moving the organisation forward under a new leadership and governance structure and re-energising it.
And I would absolutely agree with you, what you just said, Paul. So the Digital Academy is good, and they're putting through a lot of people, but the primary focus of that group is how to then become the CIOs or CCIOs in that group. So the big question, I suppose, and we need to work on it, that if we think about developing an analytical academy, similar way as the Digital Academy, but we have to open it not only for the aspiring analyst who wants to be a chief analytical officer, but also the people, the data audience, if you like, because we need to train and educate them to get their understanding right, so they understand the value of data as well. So yes, it would be really interesting time for us to work in that space and really make our voices heard by the decision makers.
Yeah.
Can I just make a quick point, Paul, when we talk about chief analytical officers, is that we need those posts creating for people to go into rather than the other way around.
Yeah, I think it needs a push and pull approach on that. The other thing that I would say that AphA need to get better at doing as well, I think we need to produce more visible output in terms of well, what are our collective thoughts around some of these prickly issues, and how what's the way forward with some of this stuff. I think it's fine to recognise and articulate a problem. Obviously, the more difficult thing is then to come up with a solution, a potential solution to that problem. And I think that's a space we need to be occupying as well. So short thought pieces on what to do about some of the additions which we've already discussed.
What are the best media to use for that, Paul? Because I mean, things like Health Service Journal, I mean, places that you've written stuff. I mean, do you have any recommendations for the best way to do that?
I think Health Service Journal is one. I think it's a good place to get some of that stuff out there. Obviously, we've done the stuff with Ben through the publication in the Journal of the Royal Society of Medicine. I think that probably has a much more eclectic readership. It's probably a bit of a narrower focus. But I think, there's no reason why I think Rony shouldn't start writing to Matt Hancock saying, this is what we need to do about this, this and this, and these are the thoughts of the association on whatever. I mean, I didn't see a problem with taking that approach. As you say, we need to think a bit bigger with some of this stuff.
We do need to, yeah, absolutely right, Paul. I think we need to make that joint decision and really take those steps to make our voices heard by all these people. And why not? One of the members from AphA also joins the SAGE committee. If they are talking about data and analytics, they need to be led by the professional thinking and needs to hear the voices of our membership. So why not? We need to really start making those noises and for people to understand that we exist, and we exist in a good way.
Yeah.
So there's lots of supportive comments, and actually there's some comments around the misunderstanding of putting in informatics under the broad heading of digital. So when you talk about digital, informatics automatically become parts of it, but it's the not well looked after child, if you like. So all of the attention goes into IT and everything else, and then the information becomes a really small and minor part. And we do really need to educate systems and trust individual organizations to think differently.
I also think it might be worth you just kind of talking a little bit about the potential role of the new Friends of AphA Advisory Committee, which we're setting up in order to not only to bring their advice and guidance into what AphA do strategically, but also for them to be aware of the organisation as well, in terms of that's a two-way street. So I think you might just want to talk about that as well.
Yeah, okay, thanks, Paul. So I'm going to write a piece in this magazine and next month's magazine about the governance structure we are putting in place. So you'll have a better idea, obviously, about the new board structure and also some of the governance arrangement, what we are planning to do to bring people together. So as Paul says, so we work with a range of partners at the moment. And the one of the important things is to really keep them involved and also also give people any space to come together and collaborate together in this space of analytics, if you like. So we are creating an advisory committee, which is like the friends of AphA. So the people who are making decision in this space of analytics, so NHSE&I, NHSX, Health Education England, Public Health England, social care, other social care partners, NHSR community, all of the people, the key decision maker you can think about, Health Education England, we will invite them and bring them together once a quarter to update them on what we are doing as an organization and what our members are telling us, so we can obviously talk about that, but also really open up conversation about what are they doing, so we can minimize this duplication and develop a more consistent way of delivering anything analytics really that everyone's trying to do. So it's not really about stopping other people if they're doing good work, but it's a way for AphA to offer a platform to bring it together and join the dots, if you like.
Well, Rony, did you have thoughts about the funding base for AphA? Because I mean, obviously that's, at the end of the day, that's going to be critical in terms of, you know, how much can be done and who's available and so on.
Yes, Martin. So I think it's a good question, and thank you for showing that on the slide, because one of the things, and people have done excellent work for AphA voluntarily. Obviously Val's done a lot of work, but we need to really focus on how we can sustain that funding, and people understand that as an entity, we need to have hands on deck to be able to deliver products. So I think the model, Martin, you talked about probably gives us a lot more flexibility in terms of the blended model if we attract some funding from some national bodies like NHSE&I and X, Health Education England, but from our sponsors, from a varied range of sponsors, and from our membership to really give us that sustainability to move forward. But we will be working in our board. We have a session plan in October when the new board comes together to discuss what the priorities would be and what we will be able to take forward. And very soon after, I will come back to you, either on a video message or in a webinar or in our magazine, or all of those channels. I will let you know what we are planning to do as an organization moving forward.
Yeah, I think the main point I was making is the importance of a diversity, because otherwise, well, one thing that can happen is if you've got everything from one place and that one place just suddenly decides to pull the funding, you're stuck.
I think absolutely,
yeah.
Martin.
Another thing that can happen is they can start deciding that they want you to do it in certain ways, and you suddenly haven't got the independence that you need.
Yeah. I think that's one of the guiding principles which I was always very strident about, is that we should remain, where possible, organisationally agnostic. And I think the way you do that is you take money from everybody. And I think you're right, Martin. I think that's the way we do it. And because we'd still need to be in a position to speak truth to power if we think there's an issue.
And, I think one of the other things, Martin, that I wanted to say, and your views will be welcomed, is about really nurturing the talent we have within the NHS. So it's very often and very quickly we see commissioners or an STP organizer in every region. If they need a piece of work doing, they will go out to a consultancy. Now, I'm not saying you cannot use consultancy outside, but what happens is they come in and they use our analyst time, and then they provide something that's already known to the system. So it's not really adding value. And of course, the end of it is what Ben said, is they are now willing to then share the code or their whole work method. So I think as an organization, we have to really encourage the nurturing the talents that we have within NHS organizations, and really spread that talent, also see if we can make the best use of them.
Yeah, for sure. And I think another aspect of that, Rony, is just educating the decision makers, about what is good and what is bad consultancy, so that they're a little bit more clued up and don't just sort of plow thousands of pounds, hundreds of thousands of pounds into stuff that is pretty useless, really. I mean, I'm really familiar with what you're talking about. I mean, without naming names, we've had consultancies come and sort of visit us in our research team and basically pick our brains and then go off and make thousands. It's, and we're a bit stupid in a way on that level. we need to charge them before they come and talk to us, and they're very nice, of course. But having said all that, I think there's a lot of good consultancies out there. I've got a lot of good friends who are working for generally the smaller ones, to be fair, but not always. But they can play an important role in this space as well. They have a different set of values, I think, that may be important.
But I think that's the point I was trying to make, Martin. I think you're absolutely right that perhaps we should work on a guidance that when organizations are looking at consultancy, they have to really meet these criteria, making the codes available, make the data available. How do they educate the local analyst, and how do they empower that learning and experience when they take on a piece of work? So it's not a money-making scheme. It's more of a helping and supporting improvement scheme, if you like. Paul, your thoughts?
I mean, I think it's a mixed bag with it. I've had some positive experiences of working with external providers. I mean, I've had some truly terrible experiences, as Martin has alluded to, of people just coming in and picking your brains and kind of regurgitating stuff with no additional value in a shiny presentation or document. I think what we need to get to is in the space where we are recognized as being able to provide something in that area, in competition with some of those people, without necessarily falling into the same trap as they do. But I think the thing which I find the most frustrating is the default position that organizations value something which they pay for and don't recognize the talent and resource which is available within their organizations to do the same job, probably better and more appropriately and more efficiently than they're paying potentially thousands of pounds for. And how do we change that mindset? That's the bigger challenge for me.
Another thing that I didn't mention in the talk, Paul, which may be an important thing that AphA can offer, is skills audits.
Yeah.
I know that's something you've been engaged with in the past. You know, that's potentially something AphA could easily offer as a service, and could probably charge, you know, reasonable amount for. So I think that's a really important service for trusts.
Yeah.
It's been a really interesting discussion, Martin. I'm aware that we have 3 minutes. Do you want to mention anything else at all, Martin, at this point? Or
well, no, just to, I mean, I think, you know, a lot of coming through from the chat. You know, I think there is this tendency to, you know, not to recognise all that's been achieved. You know, and I think particularly Paul, you know, as you're stepping down now, you've done so much to build this organisation. You know, not wanting to single people out particularly, but singling you out particularly. I think, you know, we need to recognise all the amazing stuff you've done to build up AphA over the past few years, and, you know, and obviously now handing the baton over to some extent to the new board and Rony in particular. So, you know, I think we all look to celebrate, you know, what you've done on that score.
Thank you very much. I mean,
thanks, Martin.
And you know, my hope is that it's handing over in a healthy position to a new structure which can re-energize and drive it on to the next level, and to do lots of the things which you've spoken about in your presentation, and happy to pick up that president role to support that as well. So you're not getting rid of me completely. I'll still be.
I haven't seen the back of you yet. And the other person we ought to celebrate, I think, is Val, who's sitting there smiling very modestly. I think, you know, Val's done so much behind the scenes, and you know, and often, you know, again, big hand clap for Val, I think. And others. I mean, you know, it's difficult, but I think, you know, the particular people we need to honour.
But yeah, I will say my thanks to Paul as well. Obviously, you know, continuing to having that relationship and having you in AphA would really help in our board. But also my personal thanks to Martin for the last 2 years as our president. You know, really helped us and give an independent view of, you know, what we're doing, and been really helpful to have that.
Yeah, and you're not getting rid of me either. I'm coming back.
And yes, I was just going to say that, Martin, thank you very much for still keeping involved. Martin will join our board as a non-executive lead for academia and research. So we're really pleased to and delighted to have you there. So I will obviously communicate.
Real pleasure to be part of the whole thing. It's great.
Thank you very much, Martin. That was a really good presentation, and thanks for everyone's comments. Thank you. So now we move on to the next part, which is again very exciting as the one we had before in our member show and tell. I really enjoyed the last session, so really looking forward to the next 2 presentations. I'd like to invite Alex Porter. So Alex, over to you.
Good afternoon, everyone, and thank you very much for inviting us to come to this. Great to be with you. Just hopefully I can share my screen properly because I'm not used to Zoom. Can you just wave if you can see my slides? Great, thank you. So I wasn't really sure what to bring to this session, but grateful to be nominated and receive an award. And I thought we'd share one of the main lessons we've had over the last 6 months through doing some work on COVID is how we ended up predicting wave 2 using clip art as a main analytical tool, but I'll come back to that one in a moment. Just try and minimize this thing here. So I'm here with Claire Hensman, I think, who's also on the line, our head of the analytical team in the Midlands and East region. I'm Alex Porter, I'm an analyst, been working on right care for several years, but worked in the NHS for over 10 years, working on various analytical products and teams. I'm part of the Midlands and East regions analytical teams, and we've been through an interesting year where we've had a restructure, a split along Midlands and East lines. We've had all sorts of changes going on, and COVID really popped up at a difficult time. So we had to kind of throw ourselves into this work and work out what we're doing and how we kind of work in this environment and support people. So it's been a really challenging year, particularly for Claire. She relatively recently joined the team as a new lead, was just getting to know us all, and then had to kind of this whole kind of change in what we were doing with COVID work. Some really interesting lessons from working with COVID, certainly kind of resonates with some of the professionalisation messages that you've been discussing. We had to really kind of almost, I think literally at one stage, had to break in to get into the incident cell to kind of help offer some analytical support with our team during the early days, to try and make sure that we were there, we were present, and we could offer the kind of get the understanding of what analytics they might require and how we could support our local COVID incident work. And we've kind of really very much kind of been well received in terms of the analytics we've provided. And it's certainly been a very useful experience to myself personally and to the rest of the team about professionalisation and how analytics can be impactful and useful for the region. We do have some new roles, plug our roles coming up soon. If you are interested in joining us, we do have roles from across the NHS Gender for Change bands. Some really exciting roles coming across NHS England and improvement. But yeah, please do express an interest and get in touch with us if you think you might be interested in joining. We do lots of work, normally on performance management for the region. We do work on things like right care and service improvement. And yeah, we're interested to hear all sorts of skills and kind of if you want to come and join us. But that's my plug done. I'll get to the next slide. So my jokey title, how do we predict COVID using clip art? Well, back in May, after the first wave was starting to calm down a bit and the first panic had occurred, we got asked by our regional team to give an overview of what was happening next. Where's the next peak? What's going to happen? What's going to happen soon? And how do we show the national team that we've understood all the modelling and we've got a good understanding and our own regional interpretation of what might be going on? We were asked for loads of different models, loads of different stories, interpretations of the data. We built lots of models. We had some of our own. We used national models. There's lots of intelligence that was coming to us. And we possibly spent a couple of weeks going back and forth on how do we produce this story and narrative to tell the national team and our regional team what we thought was going to happen for our region. I'm sure you've all been through this pattern of adding detail to slides, taking it out, trying to produce PowerPoint packs by committee. It was an interesting and difficult few days of working through this, of trying to get this message right. And what we realised really kind of was the message that they didn't actually want a model or the detail. We needed to do something different. And that we thought was actually talk about scenarios and vignettes. Now, I come from an operations research background and I used to work in wargaming simulation, and this was something we used all the time in that area. So example might be that we're planning a potential war with France, and you have a scenario where you discuss what that might involve and the time period that might take place. And your vignette will be the specific battle you might be interested in, such as we're going to do a Normandy beach landing and all chaos might be taking place. And the purpose of these kind of little stories, it gives you that image. It kind of sets the scale, it sets the scene, it helps people think about what kind of environment we might be into. And I think it's something we don't probably use enough in healthcare, to kind of think about scenario planning and to think about what kind of outcomes we might want to plan for. But it felt very much like in COVID, where we had a lot of uncertainty. The modelling was particularly unreliable, lots of different opinions, lots of models. What we really needed wasn't a model or a forecast, but just some scenarios and these kind of small descriptions of where we might be in the future. So we summarised lots of modelling work, and we produced, eventually we got down to one slide that kind of summarised our key points. And we talked about the potential of having a June echo when everybody goes to the beach. Might we see like a small spike in demand that we might be able to handle because the system hadn't quite recovered from COVID previously. We talked about having an autumn peak where we might see the schools going back and an increased rise there. And we talked about having a really bad winter that we thought we could be reasonable. And we included lots of different models on this, but we thought we don't need the precision, we just needed to get the messages across about what sort of things we might plan for. What we thought really added value, and why we think this worked, is we kind of kept nice simple names to the summaries that kind of described what we thought might be happen. We put really simple assumptions into the models, and they're also probably going to be wrong. You know, we didn't aim for 100% precision. We just wanted to prompt for things to help people think about things, to plan, to help our decision makers understand the data. So by putting in a really simple explanation to what the scenarios were, it helped having a good outcome. The kind of the outcomes and mitigations, there's some really complex and reasonably sophisticated modelling, and there's some accurate modelling behind it, but we just summarised it in terms of what are the actions we might need to take if this scenario happens. And we added some clip art and Google images to it. A couple of minutes of Google image searching, put those images in, and suddenly people got what we were trying to say from the modelling. So it didn't matter how complicated our modelling was, all the work behind it, we come down to these three images. Now, 5 months later, what do the senior management team remember? Those three images. We've had them come to us now saying, that picture of a school playground is coming true. And that's not the scenario we put in. We're not quite right. We don't think we've predicted anything particular there, but because we've put that little anchor in their mind, that did kind of help when those kind of images stick. And when we talk about scenarios, they're certainly are helpful. And it's really been useful to us to kind of have those sorts of simple messages. I thought it was a useful skill to share what we picked up. So yeah, that's kind of my kind of key message from it over the last few months. We've talked a lot about scenarios, models, and forecasts, and it does confuse our colleagues. We do sometimes mix up the language. We don't think we can forecast reliably more than a couple of weeks. I think perhaps we should be talking more about scenario planning. We all talk about kind of building that story and narrative as part of the Analyst toolkit and what we should do. Using images, kind of using that kind of idea of scenarios or a vignette or some of the things from operational analysis is probably a useful skill to include as part of that. We thought might be useful to share. It made it easy for the regional leads to use this. They got really good feedback when they shared it with the national team because I had those images to anchor the discussion and it really helped them get those messages across. We still get it called our modelling, even though we're not forecasting. They saw that we forecasted these peaks in winter and in autumn. And they still remember that and they still think, oh, we've done something incredible, when actually the bit that had the impact on this work was probably a couple of minutes of their PowerPoint presentation. But yeah, there we go. That's kind of our summary. It's been an interesting 6 months. Claire asked me before this presentation what we thought we could have done better. And to those colleagues who might be out there in systems, one of the things we probably haven't done enough of is sharing some of this thinking and the modelling of the data, perhaps, but some of just the ways we're setting the scene to our regional leaders around this and having those discussions within the region. I think that's something we probably need to take forward as we're starting to see a second wave emerging, is to share some of that learning across the region. But yeah, I shall stop there if anyone wants to comment or ask questions. But yeah, thank you for your time.
Thank you very much, Alex. That was really interesting. Great to see some visualization techniques used there because people do remember pictures. I've been finding these show and tell sessions from the members really, really interesting. Actually, great to see so many different perspectives, so many different ways of approaching things. And I'm so glad we've had these sessions. So we do have another one now, our last member session of the day from Rebecca. Sorry, Alex, there's lots of things in the chat which you can have a look at. So if we move now on to Rebecca Thompson from Salford with her presentation. Rebecca, over to you.
Hello. Hello, I'll just try and share my screen, so let me know when you can see it. Is that visible now?
No, afraid not.
No. How about now?
No.
There's a button that says share. Sorry, different teams.
Oh, it's saying it started. Yep, you're there. You're on like the screen mode as opposed to slideshow. You're in slideshow now. Perfect.
There we go. Technical hitch. Thank you. I'm Rebecca Thompson. I'm a Principal Information Analyst for Cancer at the Northern Care Alliance. I'm going to do a bit of a presentation on how I modelled endoscopy backlog and waiting times. So to begin with, I'll just talk about what the problem was that I was dealing with. So pre-COVID, over a third of cancer referrals for either upper or lower GI cancer would require an endoscopy as their first line investigation. And they would go straight there before even having an outpatient appointment, just straight at the endoscopy, and then be able to determine whether they had a cancer or they didn't have a cancer. For those that didn't go straight there, they would have an outpatient appointment first, and then the vast majority would then go on to have an endoscopy. Bottom line being that access to endoscopy is a really essential part of the upper and lower GI cancer pathway for our patients. However, when COVID hit on the 25th of March, the British Society of Gastroenterology, who are the body that a lot of endoscopy practicing consultants are part of, classified endoscopies as aerosol generating procedures, which meant that they required full PPE to be worn for the safety of both patients and staff. And they advised that due to at the time there was massive restrictions on access to PPE, everyone was scrambling around trying to get hold of masks to do essential care, they determined that all but emergency endoscopies should stop and shouldn't happen. So this happened, we stopped doing them. We went from doing around 250 endoscopies a week down to 30. And this continued basically for several months during the pandemic. Lots of patients were being added onto our waiting list, needing to have an endoscopy to either diagnose or rule out cancer, but we weren't able to carry out those endoscopies. So we had a big backlog that grew throughout the pandemic. By the time, sort of at the end of June, July, that things were starting to return a little bit more to normal and endoscopy services were starting to get going again, there was a massive backlog that had built up since March, but also massively reduced capacity due to social distancing, PPE requirements and staff shielding. So we're being attacked from both sides. We've got a massive demand, a big backlog and much reduced capacity. So this is a scenario that I was working in, this was a problem that I had. So what did I do around it? So I hope Gary is still on the call because I owe a lot of credit to him. So Gary developed a wonderful simulate model that allowed us to use a waiting list. So I was able to use information that I already had available. So the size of the current waiting list, the number of new waiting list additions, and the capacity that we had. And I was able to feed that information into this simulate model that was developed by Gary to pull out some information, some analysis on what was going to happen and what was currently happening. There was a lot of focus post-COVID on recovery. It was quite wide focused on how do we get all of our elective care back up to where it was. And I think the endoscopy problem got lost in that a little bit. It was one problem among many. So I wanted to find a way to sort of draw attention to that problem and show what the potential could happen if nothing was done about it soon. And this was one of the outputs of that initial model. So it was quite gloomy. It's showing that the waiting list we had at the time, which was around the end of June, was going to double and then double again by the end of the financial year. It showed that by March, there'd be an average wait of 35 weeks for an endoscopy to be carried out. This was a really powerful message and it really helped to draw attention to the endoscopy problem that we had. It showed what the current size of the issue was, but also what was going to happen if we did nothing. So following this, the organisation established a recovery programme for endoscopy, and that was able to identify some additional capacity. By the end of August, there was a plan to increase capacity by over 100%. This next chart, I was able to rerun the simulate model with that additional capacity that we'd identified and show what would happen to the waiting list now with that additional capacity in it. It showed that there's a big reduction, obviously, in the average number of days wait, but it shows what it looks like over time. So it showed in 6 weeks' time, when this new bit of capacity comes online, it's going to have this impact on the reduction, and then this bit that you're planning to come along in 4 weeks' time will have this further impact on reduction, and really show it over time. So I was able to say at any particular point in time what the size of the waiting list would be, what the average number of days a patient would wait for an endoscopy to be carried out at that particular point would be. So when I was thinking about this presentation, I was trying to think about what I learned from doing that modelling. The first thing that I thought was really important was don't go it alone. So it's the first time I've used Simulate, it's the first time I've done modelling in this way. So I found it really helpful having Gary, who's quite experienced from what I understand from what he's told me, of using this modelling and how to interpret the outcomes, the nuances of the software, how to work the different parameters that go into it, and just sense checking what I was concluding. It was quite a high profile piece of work, and the impact of it was quite important to those patients with suspected cancer. And so I was really pleased to be able to have someone sort of bounce off my conclusions and make sure I was making sense and interpreting things in the right way. The second thing I learned was that it was really important to validate the inputs. As the saying goes, if you put rubbish in, you get rubbish out. It was particularly important and impactful that we were deciding, is the capacity that the planning going to be enough? So it was really important that I made sure that I was getting the waiting list size right, that everything I was assuming was in line with what was actually happening. And then the final thing I learned was that it was really important that I was prepared to explain my assumptions and methodology. This was new to the audience as it was to me. I think the people that I was presenting it to were quite used to hearing about waiting list clearance dates, so they knew that, okay, that waiting list might clear in 3 months' time. But what they weren't really used to is being able to see the detail that Simulate is able to provide, showing the detail at any particular point in time. So I could say, okay, in 6 weeks' time, if you do this capacity, it'll look like this. However, in 9 weeks' time, it'll look like this, rather than just providing a static sort of end date. And it was really valuable and important bits of information that I was able to share with them. So it's important I took the time to explain it so that they were able to then understand how they could apply that to their decision making. And in a nutshell, that was it. So I'm happy to take any questions or comments, or if Gary's got anything to add if he's on the call. I work really closely with Gary, so I was very grateful to him.
Yeah, I think you've articulated that beautifully, Rebecca, and well done.
Thank you so much, Rebecca. Yeah, it was a great presentation and really, really useful to see the application of advanced modeling. Gary, I don't know if you want to say anything else.
No, I think other than this is a technique that's criminally underused in the NHS. It's not a new technique, and it goes back to some of the stuff that Hugh talked about earlier today, systems thinking. You know, this is stuff that we got exposed to in the early 90s, and I'm sure Martin Pitt as an operational researcher will sort of clarify those points. But, you know, this is not new, but the NHS has been really slow to embrace these types of technologies. And actually and Rebecca will probably sort of agree with this, that actually to see a system evolve over time on screen with little men running around actually is really engaging. And even the fact that it's you get that sort of real sort of runtime view, but actually there's a lot of useful statistics get thrown out of the other end that you don't see. And like I say, you know, Rebecca's used those statistics to sort of to engage her audience, which I think is fabulous. And, you know, a round of applause for Rebecca really for taking the time to sort of plough on and really start to use the technology. So well done, Rebecca.
Thanks, Gary.
Also saying that simulation modelling software is available in open source. You don't need to be spending thousands of pounds on Simulate to do this sort of work, and it's worth spending a little bit of time learning the intricacies of some of that software, because the payback is so enormous. I agree with Gary, it's underutilised, and I know that Martin and others use JamSim, which is one of those open source software pieces as part of their HSMA program. So don't think you need to spend a lot of money to achieve good results quite quickly, and actually with a bit of judicious learning you can get to a good point quite quickly Martin, I don't know if you want to say anything about that.
Yeah, I mean, this is something I've been sort of involved with quite a while, and I think, you know, there's a lot to be said for, you know, the engagement thing that you mentioned, Gary, so critical. You know, I've seen consultants, health service managers, and so on just become alive when they see a sort of animated depiction of their processes. You have to be careful. I mean, I remember running something on district nursing with completely made up data. And the people who were showing it to were sort of taking notes, and I said, "Don't stop taking notes. this is complete fictitious stuff. You know, it's so you got to be a little bit careful and a bit beguiling. But if you know, I think, you know, something like Simon Wesley Miller. I mean, Rony will be familiar with this. In Devon Partnership Trust has been using JAMSIM and discrete event simulation models very effectively to engage with some of the policymakers and, you know, people making key decisions there. So it can be very effective in engaging. And this thing about communication, you know, I think Alex's presentation was sort of made that point so clearly, didn't it? About, you know, how storytelling, the use of visualization tools and so on can be so, you know, important in making impactful interventions with analysis. Rony, you probably have something to say about that.
Thanks, Martin. Yeah, absolutely. I think the JAMSIM, the beauty of that, what you just explained, Martin, is being able to do something quickly and actually visualize and show the queuing theory to the operational people makes a massive difference when they start seeing what's going on, the kind of demand and capacity, the whole picture, how they do business planning become something different. So it's they experience something different in terms of analytics, not just KPIs or numbers. You know, it's a different way of showing people how they can redesign the service. So it's really, really valuable.
And it's the capacity to do the what if analysis is fundamental, I think, as well. So, you know, there might be certain interventions that are possible that you can actually model with a simulator and sort of demonstrate the impact of those kind of interventions. So that really does become a powerful tool at that point.
Yeah, just to add, Martin and Rebecca will also back this up, that there were some behaviours within the model that represented how we were going to treat patients. So treatment were based on pulling from priority 1 queue first, and then longest waiters, you know, and so to reenact in the digital domain what we were going to implement operationally. So that what if scenario.
Can I ask a quick
really
question?
helped as well. Oh.
Hello, can I ask a quick question? Just for Rebecca, those two charts, one with the waiting time going up and the other one with them going down, those two scenarios, how different were they? What was the extra capacity? What size extra capacity was added?
I don't have the exact numbers to hand, but it was 100% increase on what was pre-COVID. So again, assuming they had 50 slots pre-COVID, it was at least 100 after COVID. It was a massive increase. I think doing the modelling, they knew they had a problem. They knew it was a big problem, but they didn't know how big a problem it was and exactly what numbers they needed to fix the problem. So I think that was the power of the modelling. It was able to be specific enough to say, okay, if you had 75, this will happen. If you had 100, this will happen. And we're able to play with it and play those different scenarios through to show that, okay, well, if you don't take that action, then that means you've got this capacity, which means that this is what will happen in 6 months' time or in 3 months' time. So being able to play it through. Just to go back to the point earlier about the visualization and the trust in the model, I think being able to visualize it and to see, as Gary says, see the people moving along the screen or see the different points mapped out, it really helps to build trust in what can be quite a scientific and scary thing. So modeling and simulating, JAMSIM, it's all quite alien probably to operational managers. But what isn't alien is different boxes and different points moving between boxes. That's something they can understand. It's a process that they can visualize. And I think it really helped to build trust in the model, being able to show them that.
Absolutely. Thanks a lot, Rebecca.
Thank you, Rebecca. Thank you. That's really, really good. And thanks for sharing with us. Thank you and well done. I'm going to move us on to our next session. It's just a Mentimeter survey, and I'll be really, really grateful if you're able to log on to menti.com again, and I'll share my screen and answer some of the questions for us. That would be great. So let me see if I can share my screen. Hopefully this will work slightly better this time round. Can you see my screen? Hopefully you can see menti.com, and there's a code 8722959. And this is you can just to see if people are able to use this. So I will move us very quickly onto our first question. What would you want more of from the conference? So how did you feel about this? Is this a question about the conference? So hopefully you have been able to attend some or all of the session the last 2 days. So what would you like to see more of? Speak my mind. I really enjoyed the show and tell session. I think this is a great learning opportunity when people are getting together. Lots of feedback coming in. Thank you. Breakout opportunities. That's one of the things that we haven't been able to accommodate this time around. Obviously, this is a new kind of platform and way of doing it for us, but hopefully we're not going to have to do this again. But if we do, we will be able to meet in person. That's what I meant. But if we do have to do a virtual conference like this one, we'll consider breakout rooms to socialize and network. Seeing each other, although we haven't been able to see 60 faces yet, so that could have been a challenge on its own on Zoom to see everyone's faces, but
Ronnie, I don't know if anybody knows, other people know this, but you can set Zoom to see 49 screens at once if you use the up arrow next to the stop video.
Oh wow, I didn't know that, Martin. So
you go to the advanced features as a way of getting 49 screens on.
When we finish this Mentimeter, maybe this is something we could all try out and open up all of our screens and see if you're able to share. That would be a good way. I
mean, obviously 49 doesn't cover everybody, in the conference, but it's an improvement.
Thank you for your feedback on this. So the next question is that what would you like less of? Nothing, it's been good, so it's good to hear it, but we will take constructive criticism and we will work on that. But we tried to, obviously, having a different session. I think for me personally that worked well. I hope that resonates with you as well, having different sessions and break in between of sessions. That's just was really a nice way of conducting conference. More emphasizing on analytics and engagement from other trusts, of course. Yeah, I think, as you know, that everything's in a bit of an unusual situation now, and some people, I'm sure, they probably have hoped to attend the conference, but they couldn't because of various reasons. But I will set 10 seconds timer, so hopefully it will close in 10 seconds and then we can move on to the next question. There are not many of these questions, by the way, so don't be put up by there's 20 questions left. There's 6 of them. You've gone through 2, so not many more to go. So what new things or topics would you like to see in our conference? What did you feel that weren't there that you wanted to see? Okay, yeah. We have got a lot of feedback. Thank you very much. We will also share these findings with you, by the way. So if you can't see on my screen when I'm scrolling through in our magazines, we will publish some of these feedback so you can see in detail. So the next question is, how did you feel about the virtual conference? So hopefully on your screen, you'll be able to see a slider of agreeing and disagreeing. So you'll have to just move the slider and fantastic. I've just spotted a spelling mistake on the victual arrangement is much better. So apologies for that, but don't know what victual arrangement is, but you obviously agree with these statements.
Actually, I think victual arrangement would be the food. So on this occasion, we haven't had any. We had to provide our own.
Just our own, yeah. The lunch. Bring your own lunch. Thank you very much. I think the last question I have on the screen. So just one word to sum up the conference, and hopefully we can all participate, and you'll be able to just tell us how you're feeling about the conference. This is always fantastic to see the word cloud, what people think and how do we think as a group. It's very energizing for us and everybody that's put together and everybody that's attended. I'm sure resonates with every word that you're seeing on the screen. Positive, enjoyable, inspiring, really, really good words. In these difficult times, obviously, feeling good and positive is a great thing that you felt that way. I will set the timer. So that's what we have with 48 people. You have all participated and fantastic. Thank you so much for your contribution. As I said, we will publish some of these on our magazine, so you'll be able to see the feedback you've given us. Also, we will consider all of those feedback that you sent us now in our next conference. So if I stop sharing my screen, and I would like to move us on to the last thing of the conference. So I want to say a couple of words, but before I do that, can I please take on Martin's advice and let's play this out. And if you're able to put your video on, please do that. If you're watching and I want to put your video on, let's all come online and show our faces. So when you're doing that, I just want to say that I have really enjoyed last 2 days. It's been fantastic to see various different speakers, really engaging talks, fantastic show and tell session. So I've learned a lot and I hope you've all done too. Congratulations from me to all our winners, the New Socks Award. And we are living in a challenging time. So I would like to give a big shout out to all the analysts. Not everybody could be here today for various reasons, but sometimes it feels like what you're doing is not making a difference. But a big shout out to the work that you do. Be proud of what you do, and you know, keep your head held high. It's fantastic. So thank you from all of us. I'd like to just say my thanks to the speakers, the colleagues who've helped us to make this happen, particularly the organizing committee, Val Perigo, Jane Johnston, Kate Thomas, Emma Wright, and Alison Wilkinson. Thank you, because a huge amount of work goes behind the scene to make this happen. So thank you very much. It's, you know, you all deserve a round of applause, even if it's virtually. So thank you. I wanted to say my thanks to Hugh Davis, Davis Farlow Consulting. You heard Hugh talk before for sponsoring our event. And also my personal thanks to all of you for attending. and really engaging in the conversations, and also, you know, giving us your feedback on Mentimeter. It's been really, really useful. And I would also say that this is, as I said before, your organization. And I'm really, really excited to move this organization forward, but all of us together. So stay engaged and, you know, keep telling us what you want from us, and keep telling us what's good and what else we could do. So it's a huge thank you from me. I hope your evening goes well and you have a fantastic weekend. I'd just like to ask Martin if you'd like to say anything else, Martin.
It's nice to see a few faces, isn't it? I've been been wondering what people's bedrooms and living rooms are looking like. I mean, I'm hopefully this time next year we won't be in this COVID mess that we're in now. You know, and one of the things that said, what somebody said to me, is said it's all very well these Zoom conferences. You know, it facilitates a lot of things. You know, makes it easier to participate in some ways. No traveling and so on. But you know, it also emphasises how much is lost as well. I mean, meeting people on screen in 2 dimensions is no substitute for meeting people over a cup of coffee or a beer or whatever in 3 dimensions. And I think hopefully one of the things that's happening with all these Zoom and Teams calls and so on is that we're beginning to recognise just how important that sort of social contact can be. You know, when we get it back again, we'll treasure it that much more. So hopefully this time next year we'll have a conference in a great venue, and we'll be able to meet physically and have all that social stuff and enjoy, or otherwise the food. What was the expression? Victual? The victual arrangements anyway. So I look forward to seeing you next year, and hope you can make it, and just echoing Ronnie's thanks to everybody involved in the organisation of this one, because clearly a lot's gone into it, and been pleasantly surprised how well it's worked. So thanks everybody, and see you soon. Oh, and finally, Ronnie, sorry, this is a bit inelegant. I just wanted to highlight something Paul briefly mentioned. We're involved in a project with the Health Foundation, building up some introductory guides to various subjects. And what I'd like to do is organise an AphA seminar in about a month or so's time, where we can invite as many analysts from AphA as possible to come along and maybe pre-read or have a look at those draft copies in advance to give us some feedback, because I think that's one thing that we'd really value. That just getting your opinion, your critical feedback would be very essential. So please look out for an announcement about a forthcoming seminar looking at that development. Thank you.
Thank you. Bye, everyone.
Thanks. Bye.
Bye.
Bye, everyone. Take care.
Bye all.
Thank you.
Bye.